Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent. Hospitals, agencies, and associations across the U.S. are currently lifting their voices to oppose the 340B rebate model pilot program after calling for its dismissal entirely, asking for clarification to address serious concerns, or requesting exemption for certain classifications of healthcare providers. Last year, drug costs for hospitals grew 13.6%, far outpacing hospital prices, which only rose 3.3% in 2025. Without vital programs like 340B, our rural hospitals cannot support some of the most basic services their communities desperately need. That's why it's so vital we tell our stories as rural providers who need 340B discount programs to keep care close to home. On to the damage report. Reduced reimbursement and anticipation of Medicaid cuts are already cutting off access to healthcare services in rural America. In Arkansas, Medicaid and Medicare reimbursement is lower than it is in most other states, and commercial insurance payments are only 164% of the rate that Medicare pays, making it one of 5 states with commercial insurance rates under 200% of Medicare rates. Arkansas is an example of how rural hospitals have to work harder with fewer resources to keep their doors open. In the past 6 years, 8 hospitals in this state have closed their labor and delivery units, and now only 22 out of the 75 counties in Arkansas have birthing care. Most recently, Jacksonville's only hospital closed its ER and medical surgical unit due to low reimbursement and high rates of uninsured patients. Each hospital closure we hear about reminds us of the communities that get left behind, under-resourced, and lacking the access they need to vital healthcare services. This leaves communities without care, without their economic engines, and without the 24/7 safety net those neighborhoods once relied upon. And now for today's success story. Rural healthcare facilities face significant provider staffing challenges, creating primary and specialty care deserts across the United States. The University of North Carolina system recently awarded $6.4 million in funding to help several of its universities establish and grow rural healthcare workforce training programs. The purpose of these programs is to train healthcare students and connect them where they are needed the most in rural facilities. We love hearing about programs like these that place healthcare students in our rural communities where opportunities to thrive in a meaningful career can be found at your local hospital. Thank you to our sources for this episode: the Michigan Health and Hospital Association, American Hospital Association, Arkansas Center for Health Improvement, Arkansas Advocate, and the University of North Carolina System.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.